The first step in a smile makeover is ultimately sitting with the patient and figuring out kind of what they're looking to improve. So first appointment is always a consult. So first step is photos, and you want to get a photo that captures the patient's full face, because you're not just designing teeth for, you're not just trying to enhance a single tooth. You're trying to enhance that patient's smile in comparison to their whole face. Essentially, the first appointment of a smile makeover is photos, impressions, all of that gets kind of meshed together in order to create a digital wax up or a conventional wax up of some kind to give you an end result. So you want to know, okay, where are we looking to finish? So that's step one. And then based on the wax up, everything goes from there. So one of the first tools we have that's really great is you can almost do everything digitally. So digital impression, you can avoid the gunky impression material. You can mesh that and mold it to the photo. So now we can take that digital impression and we can actually transform it to the patient's mouth or the patient's face. And so you can take that photo that you took of their face with the digital impression and put it all together. And that way you can create a smile that actually suits them. And then from there, now that you have that end result in mind, then you can go about treating or prepping teeth conservatively. The more conservative you are with preps, the more you're able to stay in enamel and the more you're able to preserve natural tooth structure without removing unnecessary tooth structure. And that's like the number one goal with cosmetic dentistry is you don't want to over prep teeth, because everything you remove is not, you never get that back. You can't put it back. And that's always, I think, the big mistake that dentists make is they don't do that first step to see where the end result needs to be. Because if you don't know where you're going to finish, you don't know how much to remove in the first place. So we have some patients who come in who might have very healthy teeth and all they need is to kind of enhance the front of them. And that's where porcelain veneers come into place. But when you have a patient like that, you don't really need to prep the teeth all that much. So that patient walks out with a very conservative design for their teeth, but you're also able to put veneers on there that enhance their smile. So it's like the best of both worlds. Other people who come in with smile makeovers might need, more aggressive preparations if they have a lot of filling material on their front teeth, or they've got root canals and dark teeth in the front. So you're trying to mask and hide more. So ultimately it depends on, number one, kind of where the end result's going to be. So that wax up that you do, that shows you the end result. And then number two, figuring out patient by patient, what's the status of their teeth and what do they need to enhance without removing too much tooth structure.